Good evening, I'm Steve Lacey. May is Mental Health Awareness Month, and tonight we're dedicating this half hour to your mental health. Over the next 30 minutes, we'll take a look at the hidden impact of COVID-19 from its effects on children to employees, and even those who've already recovered from COVID. We're getting the experts to weigh in on how to restore a sense of normalcy as we start to reemerge from lockdown. Let's begin with Teresa Priolo on how children can cope with some of the changes that came with the coronavirus.
What are you seeing in your practice? How are your patients faring?
My patients are not faring well. The last day I just saw a patient who gained he's 9.5 years old, gained about 30 pounds during COVID in a year. He has separation anxiety from his mother, which he's never had before.
Throughout the last year, Dr. Diane Hess has shared her insight into how this pandemic has affected her pediatric patients.
I have another patient who was a straight A student. She's in 5th grade. And her dad called me last week and said that she's so anxious on the day she has to go to school because she finds it so hard to follow on the previous day when she was online.
For some, this last year has created mental health challenges where there were none. For others, it heightened their existing issues. It seems the resiliency we've relied on for all might be waning.
To say that kids are resilient is to say that even when people are exposed to a significant stressor or a trauma, 75% of people won't develop PTSD symptoms. They won't necessarily show a post-traumatic reaction. They are resilient. That doesn't necessarily mean the trauma wasn't disturbing or the stressor didn't significantly impact their life. I think it would be unrealistic to expect that an event that has lasted for nearly a year now and likely a number of months longer than that won't significantly change behavior.
The pandemic has created an undercurrent of instability through all of us, but the impact on communities of color is doubly traumatic. Data from the United Hospital Fund shows 57% of parental deaths occurred in 3 New York City boroughs: the Bronx, Brooklyn, and Queens.
The pandemic is a universal stressor. We would not call COVID a universal trauma, because what we're really looking at is that while the pandemic is this massive stressor for society that can absolutely increase symptoms of anxiety and depression, the kids we're most worried about are those who are experiencing the consequences of the economic, health, and kind of life devastation of the pandemic.
Each child is unique, but 2 tips both experts encourage. 1, to make sure your child or teen gets outside daily for fresh air. It's good for them physically and mentally. And 2nd, as the caregiver, try to plan special events, activities, or outings that might excite them and give them something good to focus on, like getting ice cream, enjoying an outdoor activity, or a socially distant walk with friends. Teresa Priolo, Fox 5 News.
Psychologists believe teens might be the group most impacted by the coronavirus changes. Already, teens deal with increased anxiety and depression, but take away the social engagement that comes with being in school, and dealing with their emotion gets that much harder. Fox 5 Sharon Crowley talks to 2 teens working through that very process.
It was really a life-changing experience. I feel like I had a lot of adjusting to do.
Nyalis Arias is a junior at Beacon High School in Hell's Kitchen. She's been learning from home since the pandemic started, fearing in-person school would be too dangerous since she lives with her grandmother. Her choice meant adjusting to long hours of social isolation, as well as transforming her bedroom into her classroom.
So having to turn my home into the place where I learn and attend my classes was definitely a hard transition, but I had no choice but to adjust.
Like so many teenagers, the pandemic has taken a toll on her mental health.
I definitely do think I got more anxious.
It was a little hard in the beginning because obviously being stuck at home, not being able to see my friends, and not being sure what was happening in the world really was very scary.
Daniel Shannon is a senior at Millennium High School in Manhattan, and like Nyalis, he's opted for remote learning only.
I was bored and I was lonely. I had some really great friends at Millennium, and I miss them.
He took his mental health problems into his own hands, literally. He started regularly going to the park alone to practice soccer. It improved his game and his attitude.
Getting really focused in my soccer And through that, I was able to sort of cope with being isolated and having to be alone for long periods of time.
Nyelis and Daniel are experiencing what so many teens have been enduring. A University of Michigan C.S. Mott Children's Hospital national poll showing 1 in 3 teen girls and 1 in 5 teen boys said they had new or worsening anxiety since March of 2020. And the CDC reporting mental health-related hospital emergency department visits among adolescents started increasing in April of 2020 in teens 12 to 17.
For the older kids and adolescents, they're separating. So they're supposed to be out with their peers and they're supposed to be really having their own lives. And that's so important for their development. So it is much harder for adolescents right now than for younger children.
Erica Commissar is a psychoanalyst, parent guidance expert, and the author of Being There, Why Prioritizing Motherhood in the First 3 Years Matters. She says the pandemic has hit teenagers especially hard.
Teenagers who are doing the worst in this time of COVID are the ones where there were family or interpersonal stressors in the home to begin with.
She suggests parents lower expectations for teens, especially when it comes to grades.
I think we all have to reduce our expectations. The pressure that these kids are under to achieve, even during COVID, take that pressure off of them. If they don't do so well in school this year, that's okay.
And I did ask the teens if they had any tips for other teenagers who might be struggling in this pandemic. And Nyelis telling me that she tries to keep a calendar and set small goals. And in fact, setting goals seems to be working for both of them. She'll be returning to in-person learning, she hopes, for her senior year of high school. And Daniel tells me he's been accepted to college in the fall. Sharon Crowley, Fox 5 News.
Well, working women also being stretched thin. A new study from Deloitte surveyed over 5,000 women in 10 countries from November to March. It found almost 80% reported more responsibilities at work and home. One researcher said women tell them they are feeling overwhelmed and burned out. Fox 5's Jessica Formoso talked with one working mom trying to balance it all.
I thought this is going to be amazing.
Gail Takatomi is a mother of 3. She works for an enterprise software company. She's been working from home since last year due to the pandemic. Initially, she thought being remote was going to be a great change, but
it turned into a much longer work day. It's just become overall more demanding and exhausting.
She's juggling her family, work, and her sanity. What used to be an 8-hour workday in the office is now 11 hours in front of a screen while helping her children who are learning remotely.
The longer work hours, interruptions from my family, the blurring of professional and home life, and also just being confined to the proximity of my house.
All of that taking a toll on her mental health. She says she doesn't have time for herself and there is no physical interaction with friends or colleagues.
You hold it together to some point, and then at a certain point, you're just like, I don't know how much longer I can deal with this.
You really want to set a boundary.
Maggie Mistel is a career and executive coach.
A lot of the mental health issues that I've seen from a work standpoint, because there's no off switch, there's no downtime, and our bodies are not meant to operate constantly on.
Mistel says you need to set boundaries.
You set up a quitting time, which means a time after which you won't check email and you won't be available.
If you have concerns, she recommends talking to your boss.
Let's pilot that after 6 o'clock, we don't have to answer emails, and let's see what we can do, because usually when work has to get done within a certain time, it's better. We're more efficient and we're more effective.
As for Gail, she will continue to work from home and says she has carved out time for herself. She's meditating during the day and reading more about how to cope with stress. I'm Jessica Formoso, Fox 5 News.
Coming up, overcoming an obstacle in mental health, the stigma of receiving care. A head therapist discussed the importance of mental health care in communities of color. Plus, more than a year later, and some coronavirus survivors still dealing with unexpected mental health effects. We're hearing from the founder of the Survivor Corps next. And stress from the coronavirus even impacting the way we sleep. Later, we learn more about coronasomnia. Research has shown the coronavirus has disproportionately impacted communities of color, and that inequality is also present in mental health care. In fact, the American Psychological Association found in 2015 only 4% of therapists were black, 5% were Hispanic, 5% were Asian, and 86% of therapists identified as white. But as Stacey Delicat reports, there are online networks trying to make it easier for minorities to connect with therapists who look like them.
The pandemic has taken a toll on all of us, but just as the virus has hit minority communities especially hard, so have the mental health impacts that have accompanied it.
Oh, there's an old adage that says, when America gets the flu, Black America gets pneumonia.
Nia Jones is with the Black Mental Health Alliance, which helps people of color connect with mental health care. She says the pandemic was especially hard on minorities because many still had to go to work when the virus was at its peak, constantly risking their and their families' health and safety. Plus, the killing of George Floyd and other Black men heightened fear and anxiety.
Whenever you see somebody who looks like you continually getting gunned down by police officers or others in the community, and you have to see that on a reel on TV, it is traumatic.
On top of that, struggles with issues like depression and anxiety are less likely to be talked about in communities of color.
The stigma around mental health is real, and I think it's because people hear mental health and they think crazy health. And nobody wants to be crazy, right?
Dr. Rita Walker is a professor of psychology at the University of Houston and the author of The Unapologetic Guide to Black Mental Health.
In marginalized communities where there's already, several strikes against you for being a person of color, you don't want to add on top of that feeling like, oh my goodness, someone is belittling me because they think that I'm crazy or that there's something wrong with me.
On the flip side, Dr. Walker and Nia Jones agree. One silver lining of the pandemic, with almost all mental health services going virtual, more people may have been willing to give therapy a try.
It has quite literally changed the game in terms of people having access to care.
And telemedicine is now likely here to stay.
A lot of people who otherwise would not have thought seriously about mental health have been willing to see someone virtually because it just feels a little bit more comfortable.
Stacey Delicat, Fox 5 News.
And those who've recovered from COVID are also finding some surprising effects from the virus, long-lasting mental health issues. These so-called COVID long haulers continue to battle brain fog, anxiety, depression, symptoms that linger months after the virus itself has gone away. Joining us now is Diana Berendt. Diana was diagnosed with COVID more than a year ago. She is now a survivor advocate and founder of Survivor Corps. Diana, welcome. Thanks for being with us.
Thank you so much for having me.
So first off, how are you feeling now? This long hauler syndrome is so difficult. I know it's presented such a challenge for so many people.
I have to say that I am extraordinarily lucky, and I am a much better spokesperson than I am an example. If I was suffering the way most long haulers are, I wouldn't be able to be sitting here with makeup on and doing this interview at 5:45 at night.
Right, and I know one of the challenging things is sort of separating out the neurological issues from the physical. That's where it gets tricky for a lot of people. What's your advice for someone who might be out there suffering and not really sure exactly what to do going forward?
Exactly. And it is such a vexing issue because we're talking about mental health, and we have all been through such trauma. And imagine added to that, having been sick with COVID for 6 months or a year or over a year and not being able to get answers. And so what we need to remember is that, yes, there is anxiety and depression, and those are reactive. They are absolutely normal reactions. But what we are also seeing is that there's something about this virus that actually primes the brain, whether it's inflammation or something else that we haven't figured out, to make it intrinsically susceptible to overreact to all of those stimuli. And so it is a very difficult thing. We have to remember that when you're talking about mental health with long COVID, we have to consider neurological health simultaneously.
Indeed. And, I know oftentimes we tend to brush over teenagers who have gotten COVID, but the long haul syndrome is a particular challenge for them as well.
Absolutely. I can't even tell you. I get heartbreaking emails every day from parents and grandparents of mostly young adolescents who are having literal psychiatric breaks. And that is not abnormal for a post-viral condition. It's abnormal for it to be happening at this rate, but there are methods to get treatment. It is so important that if you are seeing that in your child or if you're a clinician and you're seeing that, please don't automatically assume that this is something that can be dealt with simply with talk therapy. Yes, that might be needed as well, but a full medical evaluation is needed.
Indeed, it's a very challenging subject for sure. We wish you well. We wish you continued success and good health. Thank you, Diana Berendt.
Thank you.
Doctors are reporting yet another side effect of the pandemic. Patients struggling to get a good night's sleep. They're calling it coronasomnia. Dr. Ross Levin, a behavioral sleep specialist here in the city, says he sees an increase of patients since the pandemic started. Some reporting issues with sleep, insomnia, and even nightmares. Dr. Levin believes the stress and anxiety of the pandemic is a contributing factor.
It has been over a year. People are getting cabin fever. People have lost their jobs. People have lost their relatives. People can't get out of the house. And so there's a trapped feeling and there's an uncertainty feeling.
Dr. Levin recommends doing activities that distract you, like getting out of the house, exercising, calling your friends, or listening to music. He says this will help you relieve stress and anxiety and help you sleep better. While things are finally starting to head in the right direction in our area, the tri-state beginning to reopen, that means we have to get back out there and change the way we think. Even Mayor de Blasio had something to say about that this week.
We got to understand we're leaving COVID behind. We can't live in the grip of COVID the rest of our lives. It is going to be in our past as a crisis. It may be yet another disease out there like the flu and other things, but it will be manageable. So we got to put COVID behind ourselves mentally, too.
For those who might be having a tougher time readjusting to our new normal, psychologists say we have to change the way we define normal. Here's Fox 5's Matt King.
Normalcy or returning to normalcy. There's no such thing.
Rutgers University Associate Professor of Psychology, Dr. Peter Economou, not only expects us as individuals and a collective society to struggle to return to pre-pandemic life as our various cities, states, regions, and nations reopen at full capacity, but also things we probably shouldn't aspire to.
Everything's always changing. And so what we're going to be returning to is a new moment and a new experience.
And that change, understandably, provokes anxiety because we don't know what this new moment means or what it might look like.
I think a lot of people are going to continue to wear their masks no matter what.
Yeah, because you're always afraid anyway. Even if you're vaccinated, we're always going to be afraid.
It has been so drilled into us to put your mask on.
We didn't jump into this. We're not going to jump out of it.
Part of this involves you taking interest in the well-being of other people.
UConn sociology professor Kenneth Vaughn admitted to looking forward to a time when he feels comfortable returning to places, participating in events, and seeing people from his pre-pandemic life. But he cautioned us from thinking of the challenges, costs, and benefits of reopening as purely economic.
So what I'm really excited about, what I'm looking forward to, is the return to voluntary associations.
When we sign up for community service or an exercise class, go to church, when we play chess in the park or meet with a book club, we build trust in other people, our institutions, and our greater society.
And that's good for you. That's healing for you.
And thus, voluntarily associating with others, per Vaughn, represents a large part of both the when and the how our society recovers from the trauma of the last year, but does not necessarily return to something entirely familiar.
The atmosphere, the energy, it's still lacking. I miss it terribly.
I think it's going to be very hard.
Habits can be, reevaluated. They can be improved upon, and we can create a new habit.
The global nature of our pandemic experience in a world more connected than it's ever been creates a unique opportunity in the history of civilization to use an experience shared between every single human on Earth, perhaps like nothing else before it, to either assign blame, foster division, and focus on isolation, or create connection, embrace humanity, and commit to learning.
So we have that choice to make where we are investing in each other's healing. And I think that can be something that goes into the history books forever.
I'm Matt King, Fox 5 News.
And before we go, here's some other advice from psychologists about reopening. Dr. Crystal Lewis from the National Institute of Mental Health recommends following the CDC guidelines about staying safe while traveling if you're still working through grief. Allow yourself to continue to grieve. There's no specific timeline or deadline you should worry about. It would also be helpful to plan for things you look forward to. If your symptoms continue to bother you every day, like if you have high levels of anxiety or if you're worried about leaving the house, don't be afraid to try a therapist. You could even talk to one online. All right, we hope our half hour helped. If you'd like more info, we'll have some more resources on our website, fox5ny.com. Just click on the story featured right on the homepage.